Our next speaker is Divya Anand, and her talk, Narrative Writing as an Exercise in Deliberate Empathy. Divya is a third-year medical student. She graduated from Johns Hopkins University with a BS in Molecular and Cellular Biology in 2020. During her time thus far at RWJMS, she has explored her passion for narrative medicine and has served as an executive board member of the Arbor Vitae Literary Society and a co-founder of the Distinction in Medical Humanities program. She has also published pieces in the Intima magazine and in the 2022 AV Reader. Divya is a passionate student doctor to her patient in RWJMS's Promise Clinic. In Divya's free time, she loves to cook fusion food, especially with flavors and techniques from South India, birdwatch, as well as sing Bollywood, Carnatic, and R&B music. So welcome, Divya.
Hi, everyone. So this is a talk about narrative writing as an exercise in deliberate empathy. And thank you so much for the introduction, which tells you that I have been writing for a little bit since, especially since starting here at RWJ. I've started to explore narrative medicine, and I found myself really drawn to writing about patients and writing about their stories, and especially writing about them outside of that office space, in their homes, in their lives, in places where they're people and not just patients, and we can explore their lives in a different way than we usually do. So for a moment, I'd like you to just read this and see how you feel about it. And think about what would you do for this person? And we'll come back to this in a little bit. So empathy is a skill, and it needs to be practiced. And it can also easily be lost in the mayhem of clinical work and what that looks like today. And this is partially the nature of the beast. Most of us go through our most rigorous training, our hardest times during residency, just when we're starting our careers as physicians. And that leads to sometimes we might think to ourselves, I wish this patient would stop talking to me so that I can go home. And we might think, this patient or their family is being really difficult because they're asking so many questions. And these are natural thoughts. Every day we go to work and we open up Epic and we have our smart phrases and templates and dot phrases and all these things where we try to cram our patients into small boxes. So writing about them in a narrative sense can take them away from that box and let us ask open-ended questions and be imaginative and try to think about them outside of the clinical setting, think about their lives, and try to understand them as the people they are. So I'm going to ask you to do an exercise with me. And I understand that most of us probably don't consider ourselves to be writers, and that's okay. Nobody needs to ever look at this again. You don't need to look at this again. You can rip it up and throw it away, and it will still be valuable that you've done it. So pull out your notebooks, pencils, probably your notes apps, and here's your scenario. So your patient is 60 years old. They smoke. You don't want them to. And I'm sure this is familiar to many of you. So I'm going to ask you a series of questions, and I want you to come up with answers for your imaginary patient and be as creative as you can be. Try to think about their lives. So why did they start smoking? And why do they continue smoking? Who's involved in this story? Who are the players? Who are the characters? What does your patient feel when they smoke? And what do they feel when they try to stop? And most importantly, what drives them in this situation, and what are they most afraid of? And feel free to say anything that you think of for this person. So I'm going to share a couple of my patients who are in this situation. So we have a 60-year-old male. Let's call him John. John started smoking when he was 17 because his older brother did, all of his friends did, so he felt like he needed to as well. And he's tried to quit half-heartedly several times, and only because his wife wanted him to. She thought it was disgusting. So he tried. But after his wife died, he stopped trying altogether. And when his doctor tells him, hey, maybe you should stop smoking, he just nods. He nods, but he has no intention of doing that because he says that smoking makes him happy. It's something that he wants, and he doesn't see a reason to stop. Here we have a different patient. She's a 60-year-old woman. Let's call her Eliza. Eliza started smoking in the early 90s after she had her last child to help her lose the baby weight. Smoking kept her appetite down. It kept her figure slimmer, and it kept her feeling like she was beautiful. And at one point, she quit for a full year. And during that time, she gained the weight back. And she felt really terrible about herself every time she looked in the mirror. So then she started again. And she was ashamed, but she was also relieved. I have a few generous colleagues who have agreed to share some of their notes with me. So I'll ask them to tell me what they've written down as the answers to these questions.
Okay, so the patient I was thinking of started smoking when he was 13 years old because his older brother was smoking too, so it was like the cool thing to do. And he just kind of continues to smoke now because it's just a regular part of his day and his routine. His wife doesn't like that he smokes, and his 7-year-old granddaughter also recently learned at school about the harmful effects of smoking and asked him to quit. So he tried to quit cold turkey once, but was pretty quickly unsuccessful. When he smokes, he feels de-stressed, and when he's tried to stop, he feels anxious and distracted. He does want to be healthier for his wife and family, but he's kind of afraid that he's going to miss smoking as part of his everyday routine.
Okay, so my patient began smoking when he was 20 because his friends did it, so he wanted to fit in. But he wasn't worried about being addicted because he thought he was stronger than that. One cigarette became 2 packs per day over the next 40 years. Cigarettes were practically on the weekly grocery list. He tried quitting when his kid was diagnosed with asthma, but couldn't bring himself to because those were the only things that caused him relief. He was hopeless and ashamed because quitting felt impossible. He was afraid of having to live life without the only comfort he knew.
So my patient is a 60-year-old female. She started working because at her workplace it was, quote, the cool thing to do during breaks, and was sometimes the only reason that she and her coworkers were given additional breaks. Her boss often joined them as well to smoke. She feels smoking is a way to fit in and almost embodies the culture of her workplace. She has only worked at this place for about 2 years, and she only started smoking when she first took the job. She does feel some guilt about smoking because she knows how dangerous it is, but she struggles to fit in already and does not want to alienate herself. She hasn't tried to stop due to these fears.
All right, thank you so much. I mean, these are beautiful narratives, and they're all very different from each other, and thank you so much for sharing. And I'll call on you again in a little bit. So these are just one-paragraph blurbs about our patients, and we could probably write pages and pages about them if we tried. So let's ask some more questions and delve deeper into their lives. So let's talk about our second patient, my second patient, Eliza, and we'll ask, what does she have going on in her life? And if there are different time periods in her life, how is it now? How was it before? How have things changed? What makes her the way she is? How is her health, mentally and physically, overall? And earlier we asked, what drives her and what is she afraid of in regards to smoking? And now we'll ask these all-important questions about her life. What drives her and what is she afraid of? So I'll tell you about her. Eliza has 3 children who she's very proud of. They're all adults, they've moved out, and according to her, they're doing amazing things, which they are. They're doing nursing and law and computer science. She lives at home with her husband. They have a great relationship. She works as a secretary in her hometown. Her husband loves to golf. Sometimes they go together. She feels a little bit down some days. she feels better when she's at work, but when she comes home, sometimes she says it feels empty. She thinks that when she was younger, at some point, she had an eating disorder, but she thinks that those things weren't really diagnosed as readily at the time, so she wants to let bygones be bygones. Physically, she says she just has a little bit of hypertension, and of course, she smokes. But other than that, she's well. Now she says she's too old to have an eating disorder. And she says that since her weight hasn't changed at all, her relationship with food doesn't matter. She is not afraid of getting a stroke. She's not afraid of getting cancer. She's afraid of becoming fat, and she'll do anything to avoid that. So now we know a tiny little bit about her. And we can ask the question, now that we know her, what can we do for her? So for her, we can recommend therapy. She says she'd be willing to talk to somebody about these issues that she's having, these feelings she's having, but she would only think about it if someone suggested it to her first. So that'll be our job. We'll ask if she would like a counselor to talk about her relationship with food, potentially her body image, and we'll see if that helps. We can also give her dietary education, either ourselves or we can recommend a nutritionist, and we can see if there is a diet that is healthy, that can fit her goals for what she wants for herself. And then, at that point, maybe after a long time, she might want to quit. She might be able to quit. And then we had our other patient, John. For him, he's telling us in no unclear terms, smoking makes him happy. It's what he likes. So our job is to educate him. We want to make sure that he can tell us all of the risks that come with smoking, any adverse outcomes that we're worried about. We want to make sure he really understands, he knows the risks. But then beyond that, we can just ask him at his annual physical, have you thought about quitting again? And if he hasn't, we'll leave him be. We will respect his autonomy as a person and let him do what he's going to do. So if, again, my generous colleagues would be willing to share any ideas that they might have for their patients, I'd love to hear them.
I thought for my patient, he really cared about, smoking being part of his everyday routine, but didn't like the health effects of it. So I was thinking we could help work with him on finding something else to replace smoking in his daily routine, something else that he might like to do that will fill that same role.
Awesome. Thank you so much.
I think for my patient, he could benefit from therapy because he seems to have this big reliance on smoking to, kind of escape a lot of stressors he's having. So kind of working through those stressors and, also pharmacological interventions as well if he needs it.
Absolutely.
For my patient, I think it'll definitely be important to participate in some type of motivational interviewing and figure out what are feasible goals for her specifically in this situation, and maybe try to give her other options to participate in during these breaks that she has at the workplace, such as drinking soda or using a toothpick to kind of occupy the behavior of smoking a cigarette, as well as provide her any pharmacologic options as well if she needs them in her goal to stop smoking.
Yeah, absolutely. And those are all fantastic responses. And what I notice is that they tailor the response to the narrative that they've written, to these questions, not about this person's, medical history, but about their life, their day-to-day. Who are they and what role does smoking occupy in their life? So if there's anything to take away from this, other than try to write about your patients sometimes, ask the right questions. Specifically, if possible, investigatory questions instead of accusatory questions. Find out the why behind why anyone does anything. Think of health issues as people with problems and not just as problems, which can also help us create solutions that make sense for the person who has that problem. And then if you feel that there's a disconnect in communication between you and your patient, you're not really understanding what they're saying, they're not understanding what you're saying, you're just not on the same page, try to get on the same page. Try to see what is their perspective. Try to understand them, and then meet them where they're at and go from there. And then finally, when you are writing these narratives, you have the privilege of a great deal of medical knowledge. So when you're writing these narratives, avoid going into the hole of, I would never do that. Of course you would never do that. You have years and years of education and training. So take that training, throw it away, and then think of what you would do if you were not you. Thank you so much.